to record?
Yes.
Okay. Let me make sure I put that together. Okay. Well, good evening, everyone. My name is Mayor Beverly Burks, and I am proud to be the mayor of the city of Clarkston, the most diverse city per square mile in the United States. On behalf of the city, I'd like to also thank our partners and sponsors: Georgia State University School of Public Health, Georgia State University's Prevention Research Center, CDF Action, and the City of Clarkston's Early Learning Task Force. Tonight, we focus on COVID-19 and children, with a particular focus on two important topics: COVID vaccinations for children and mental health issues among children related to COVID. We are looking forward to hearing from our speakers, and we specifically want to hear from you, our participants. Your questions, ideas, suggestions, and any resources you would like to share. Welcome to our moderators this evening, Dr. Ashli Smith Owen and Ms. Roberta Malavenda.
Thank you, Beverly. It's always lovely to have you with us, and we're so fortunate to have you as a spokesperson for issues we care about, and I know that you care about deeply, and all of your work on behalf of COVID vaccination and getting the word out about the importance of getting vaccinated and all the work that you do. I'm Roberta Malavenda, and I'm Executive Director of CDF Action. And I always say we're a small but mighty organization that seeks to really engage residents and particularly families with young children in the decisions that matter to them. We say we're an asset-based community organization that looks at community strengths and really works to transform and make early learning in particular more equitable for our children and their families. We have a number of programs, and one of the things that we did today, for example, we had a Ready School, which is in person in several of our sites, but on Thursdays we have a Zoom, and all the children and their families gather on Zoom, and there are 3 and 4-year-olds, and can you imagine how much fun we have? And we have a storyteller, and we have it in 3 different languages, and we do movement, we do arts and crafts, and we do lots of moving, and it's great fun. So I always look for the bright spot when there are challenges and opportunities, and this afternoon, or actually this morning, was one of those fun things. But today we're really excited about this panel, especially our guest panelists. And it's very exciting for me to introduce Ashli Owen-Smith, Dr. Smith, to all of you. Many of you know her, who has been a great partner with so many of us to make things happen in Clarkston. And she lives in Clarkston. So welcome, Ashli, and take it away.
Thank you so much, Roberta. And it has been just an absolute pleasure to work with you and CDF Action, and Mayor Burks has been such a cheerleader to the Prevention Research Center at Georgia State University and all of our work in Clarkston. So I think it has been and will continue to be a really productive partnership. And, for those of you who don't know, the Prevention Research Center is housed at the headquarters on the Clarkston campus of GSU. And our goal is to address social determinants of health among refugee, immigrant, and migrant communities in particular in Clarkston, but also serving all Clarkston residents and those nearby who live, work, play in Clarkston. So we hope some of you, our fellow residents, are on the webinar tonight, and welcome you to get involved with our work. You can go to our website, prc.gsu.edu, and there's more information there. Just a brief review of our agenda tonight. As Mayor Burks and Roberta alluded to, we're going to be focusing first on children and the COVID vaccination. And we're going to be asking our two panelists, both of whom are physicians, some questions about the vaccine. And we welcome you to use the chat function to provide your own questions. And then we'll also have some time at the end for them to answer any additional questions that you may have. I know there are a lot of questions that parents, caregivers, other people who work or interact with children have about the vaccine, myself included. So I'm really looking forward to learning from them and hearing from them about the vaccine as it relates to kids. And then the second half of our discussion today will be on the ways in which COVID has affected our children in other ways, socially, emotionally, cognitively, educationally. And so we'll be kind of prompting the panelists with some questions about that, and then just having some open discussion about the ways in which COVID has affected children, which we know has been profound in a lot of different ways. Just a reminder to please make sure that you are muted if you are not speaking. Please try to save questions to the end, or please, again, feel free to use the chat. The session is being recorded and will be available to participants on our prc.gsu.edu website. And at that, what I'd like to do now is to have the panelists introduce themselves before we begin with some of the questions about kids and the vaccine. So let me ask Dr. Reines first, please, to just introduce yourselves to everyone briefly.
Thank you, Ashli, and thank you so much for inviting me to be part of this. This is an honor. My name is Dr. Susan Remus. I'm a pediatrician, and I'm an assistant chief of pediatrics at Kaiser Permanente. I also do some work over at DeKalb County Board of Health in the refugee clinic.
Thank you so much, Dr. Reines. And Dr. Johnson, if you could introduce yourself as well.
Right. So good evening to everyone as well. And I, along with Dr. Reines, just ecstatic about being asked to be a part of this panel. It seems as though I've been part of so many panels over the past few months because of all the things that's happening to our children. But I'm a general pediatrician as well. I'm professor of pediatrics at Emory University, and I direct a program called Partners for Equity in Child and Adolescent Health. And the goal of Partners is to advance health equity throughout the state of Georgia. And so I do a lot of work throughout the state, building systems of care for children. Everyone who knows me knows my passion is school-based health, and I won't get into that because that's an hour-long lecture. But I also look at training residents and medical students in the social determinants of health, creating a family-centered approach to provide primary care for at-risk families, and also advancing early childhood education through Reach Out and Read program. So again, thank you for having us here, and we're here to answer questions.
Great. Thank you so much, Dr. Johnson. So I think what I'd like to start with, if I may, is to ask both of you to comment on what we know about the vaccine for children in terms of what the science says, kind of where things are with vaccine approvals, kind of the basics of the science around the vaccine and the safety and kind of the approvals of the vaccine.
Do you want me to go first?
Sure, that'd be great, Dr. Reines.
Okay.
And then Dr. Johnson can jump in.
Sure. So as probably most people are aware, the 5 to 11 year, there's been recent emergency authorization for the 5 to 11-year-old group getting the Pfizer vaccine. So previously we had emergency authorization for the 12 to 15-year-old group. And over the age of 16, we now have full FDA authorization for the Pfizer vaccine as well. So that's where we are with approvals. And I think that many of the practices around Georgia in DeKalb County have started giving vaccinations to the young children, 5 to 11 years of age. There are several sites as well, part of Children's Healthcare of Atlanta. And I think Ashli's going to show a slide where children can receive those vaccines a little bit later on. but it is approved, fully approved for 16 and over, and there is emergency use authorization for those 5 to 15 years of age.
Exactly. And, you know, the data is overwhelming, right? So I was listening to a podcast the other day, and they said that the COVID vaccine is probably the most extensively studied vaccine in the history of vaccines. And I know a lot of people are really concerned because they thought, boy, it really didn't take very long to get this vaccine out, to get it to market, to get the emergency use authorization and then the full authorization. But the reality is, when you think about it, when COVID hit, essentially every scientist, every medical institution all over the world stopped what they were doing to study this vaccine, right? And they probably ran more trials with this particular vaccine than any other vaccine. When it became available to adults, you know, the bulk of the research had already taken place. And so when they started studying it in children, they really didn't have to do as extensive research as they did for adults. They did what they call bridging research. And they took all of the data from the adults and they applied it to the children. I think what's really remarkable about this 5 to 11, which we're incredibly ecstatic about the fact that it's available to our children, because for many reasons, because we want our children to stay safe, but we also want our children to be in school, right? And what's remarkable about it, when they were testing it, they realized that they only had to use a third of the dose for adults for children. So that meant that has highly immunogenic, that is very, very effective, and it's also safe. It's not as reactogenic because not as much of the virus is needed for the vaccine. So it's been proven to be very, very safe and very, very effective for our children. And, you know, when I talk to my parents all the time and they say, well, you know, Dr. Johnson, I just don't know about this. You know, I'm really leery about, you know, the time that it took. I'm really leery about the safety of it. And I try to reassure them that it is, but I said, but you know what? The vaccines that we give every day to children, we probably haven't studied it nearly as much as the COVID vaccine. So we're really, really excited about this because now we can actually offer protection for our children, and our children can go to school safely. And all this vitriol and concern about mask wearing, at some point, hopefully in the near future, we can put that to rest because of all our children will be vaccinated and safe, and we won't have to worry about transmitting the disease within the school and also transmitting the disease to family members. So I just want to reassure everyone that this is probably the safest vaccine that we've ever created for children or adults in the history of vaccines.
Wow,
Yeah.
that does feel really reassuring. And that, yeah, to me, that feels kind of, I feel like I can take a deep breath hearing you say that. Dr. Reines, can you comment on kind of some of the questions that I've been hearing are things like, well, what are the side effects like for kids, and do they have to get as many doses? So like, is the kind of process of getting the actual vaccine and then kind of what happens immediately after, does it look the same for children as it does for adults?
Yes, so far it does, except as Dr. Johnson pointed out, the vaccine does appear to be less reactogenic, meaning kids are having fewer side effects initially. So first, to talk about the number of doses, right now 2 doses of the Pfizer vaccine are going to be recommended for children, and spacing those doses about 3 weeks apart. So that's going to be the same as adults. For the adults, for many adults, it is recommended that they get a booster vaccine 6 to 8 months later, depending upon whether they're immunocompromised, underlying medical condition, age. At the moment, we're not recommending any booster vaccines for children. And I think that as we study the effect of the vaccine in children, as we monitor antibody levels in children, we'll know when immunity begins to wane. And I think this data will then lead us to the next steps as to whether a booster is going to be recommended. So 2 doses, 3 weeks apart. In terms of short-term side effects, they're really the same as with any vaccine. Children can have some low-grade fever. They can have some redness and swelling at the injection site. Some children will complain of some headache, some joint pains, some muscle aches and pains. Sometimes children complain of a tummy ache, but those side effects are expected to be very short-lived. And again, I really want to stress that we expect to see fewer side effects in the kids than we have seen in adults. And I think we expect to see more side effects, maybe slightly more side effects after the second dose of the vaccine. They really haven't seen any more significant side effects in the population that was studied. Excuse me. There were about 2,500 children that between 5 and 11 years of age who were in the study before this was authorized. And the problems like myocarditis and pericarditis, which you may have heard about, that is seen more commonly in the children over the age of 12, was not seen in this group at all. Myocarditis and pericarditis, even in the older children, is very rare and is estimated to occur in about 1 in 20,000 cases to 1 in 50,000 cases. So it may be, as we see more young children being vaccinated, that some different side effects or even this side effect may emerge. But to date, it has not been seen. And again, I want to stress that even the pericarditis and the myocarditis that was seen was mild. There have been no deaths due to this vaccine. There were a few children that were hospitalized, but the majority of children did not need hospitalization, and they recovered with ibuprofen or another non-steroidal anti-inflammatory. And one more point about the myocarditis, pericarditis, if a child contracts COVID infection, the incidence of myocarditis and pericarditis is much higher after natural infection than it is after immunization. I said a lot there, and I gave you a lot of medical technical terms. Any questions or anything that needs to be clarified?
I also want to add that the myocarditis, when you get COVID, is worse than the myocarditis that you get from the vaccine. So that's another point.
Yeah.
Well, I was going to ask both of you, and you know, Dr. Johnson, maybe you can add to what Dr. Reines said about this. I was going to ask, you know, one thing that I've heard parents and caregivers and other people who work with children, but particularly parents and caregivers say, you know, well, everybody says that COVID is not that bad in children if they do get it, that it's like generally pretty mild in most kids. So why should I get my kids vaccinated if the disease itself is going to be so mild and not that different from like a cold or flu, which they get all the time anyway? So I wonder if maybe you could respond to that kind of question.
Yeah, we hear that all the time. The reality is children get really sick. Now, it is clear that children don't get as sick as adults, and they're not hospitalized as often. We've had about, close to 100 children die from COVID in the United States. Well, some people say, well, that's not a large number, but it is for that one parent whose child died from COVID, right? We've had about 8,000 hospitalizations. We know that when children go back to school, the transmission increases, and that the likelihood that children will get really sick and add to that death toll will be there. The reason that we don't have deaths from some of the other childhood illnesses anymore is because we immunize children against it, right? And this is another illness that we can immunize and can prevent children from getting really sick, and even to the extent of dying. And so even though children don't get as sick as often as adults, they do, and they die. And they have really long-term, some of them have really long-term consequences as a result of it. Someone once asked me, do children get long COVID? Well, we don't know yet. They might, they may not, but we know they get something called multi-inflammatory system disorder, which occurs about 6 to 8 weeks after they've been exposed to COVID or have actually had COVID. Sometimes they don't even know they've been exposed to it, and they get this really severe inflammatory disease as a result of COVID. They get really ill. About 85% of the children end up in the ICU. A few have died from it. So we know that it really does have a pretty dramatic impact on children, not to the extent as adults, but they still get really, really ill. And so if we can prevent one child from dying, that's what we should do. And that's why they should get the vaccine.
And I'll just add that we've had more cases of MISC, the multi-system inflammatory syndrome in childhood, in the Southeast than anywhere else in the country. And Children's Healthcare of Atlanta actually boasts having the most number of cases in the country. That's very impressive. And that really speaks to our poor vaccination rates that we have in this state and lack of mask wearing that we have in this state. And so MISC is a very real concern. As a single pediatrician, I have seen 6 cases of MISC in my office that I have diagnosed. And that's a lot for one pediatrician. And my partners have diagnosed others. And so this is very real. And I will say that I'm reading more and more, Dr. Johnson, about long COVID in children. And there are centers popping up all over the country. We don't have one yet here in Georgia that are clinics to care for children who have long COVID. But children are complaining of the loss of taste and smell that is long-term, exhaustion, fatigue, headaches. There's something called postural orthostatic hypotension. Postural orthostatic tachycardia syndrome, or POTS, can be an effect where children have these episodes of dizziness and feeling like they're going to faint that have been attributed to COVID infection. So I think we're still learning a lot about COVID, but it looks like children can be long haulers too. And you don't have to have a severe COVID infection to be a long hauler. You can have a very mild infection and be a long hauler. And you can have a very mild infection and develop MISC. And you can have a completely asymptomatic infection and develop MISC. So this is a very strange illness. The other reason to vaccinate kids is it helps keep the adults who are around these children safe. Right? So even if the child is going to have a very mild course, and as Dr. Johnson said, most of them do, they can bring it home to grandparents, they can bring it home to family members who are very vulnerable. And so this is really a public health responsibility as well. We should all be taking care of each other and caring about the health of each other.
That's a great point, Dr. Reines, because I have heard parents and caregivers, who I think are, acknowledge and are saying that, we're hearing so much about how important masks are, how effective masks are, and how we all need to be wearing masks. And so naturally, some parents and caregivers probably have said, well, can't my kid just wear a mask? Like, why do I need to vaccinate him or her if they're wearing a mask at school all day long or at daycare all day long? And to me, kind of what you were just saying might be, you tell me, but might be one answer to that, which is that they may not be wearing masks, or they probably aren't wearing masks when they come home to the family, right? So that seems to be one logical answer to that question of like, why can't we just rely on masks? But I wonder if you have anything else to add to that particular question.
I think the only thing I'd say there is that masks are not 100%, and there's certainly all different types of masks. Masks help to mitigate the risk, but masks are not the only thing. I think CDC has recently put out a report, and they really emphasize a layered approach. So it's not just one thing, it's not just masks, it's also social distancing. In schools, 3 to 6 feet is what is recommended. It's also vaccination. There's multiple things we have to do. People can get COVID infection even if they're wearing a mask all the time. I've had families say, Dr. Reines, we were in the house, we masked all the time, but somehow COVID found us. And this is a tricky little virus, and it's very contagious. And it has a way of getting in.
In addition to that, CDC recommends that you wear a mask even if you're vaccinated, right? So again, like she said, masks aren't 100%. And then all the vitriol and all the animus around children wearing masks should really motivate some parents to really want to get their children immunized, vaccinated, so that at some point we can stop wearing masks, right? And if you've ever been into any schools, well, I have to tell you, the little ones seem to wear their masks better than the older ones. You can tell that, they go into the school with their mask and about halfway there, the mask is like on their chin, right? So it's a very difficult thing to police in the schools because, the teachers are really working hard to catch children up for being behind. But again, like Dr. Reines said, it's a multi-layered approach to fight this disease and to fight the transmission of it. And masks is just one thing.
So, Dr. Johnston, I wonder if you could comment on one question that we've been hearing where parents and caregivers, have some concerns about the fact that the younger group is the vaccine is still under emergency use authorization.
Mm-hmm.
And the question is, well, should we just wait until it's fully FDA approved to get that cohort of kids vaccinated? And I wonder if you, and then Dr. Reines, if she has anything to add, could comment on that emergency use authorization period, and if parents, and kind of the rationale for why children maybe should proceed with vaccination even during an emergency use scenario.
Sure, that's a good question. The emergency use authorization really requires a lot of rigor in order to actually get that authorization, right? And they go through the same phases of trials for vaccination for emergency use as they do for full authorization. It's just that they conduct more trials is what's happening after the emergency use. And the trials that they've conducted, they've gone through all three phases of them, even with the emergency use authorization. The first trial is usually looking at safety. The second trial is looking at effectiveness. And then the third trial is looking at safety and effectiveness. And they just repeat these trials over and over again until they get to a point, where it's scientifically valid that, they can remove the emergency use authorization. They've proven that the vaccine is safe, even under the emergency use authorization. They've proven that it's effective, right? And the trials are ongoing. They need to understand that, right? I think at this point, with all of the trials that have taken place prior to this, and the fact that we have full authorization of the other vaccines, I think it's safe to transfer that mindset onto the vaccine for the younger children. But they've proven that it's safe. They've proven that it's effective. Just because it's emergency use authorization, it just means we're trying to get it out there quicker, so that we can, save more lives and decrease the morbidity associated with it, and so that we can get children back into the schools, so that they can, catch up from all of the deficits over the past 18 months. And so I wouldn't worry about the emergency use authorization. It's just as safe, even if they had full authorization.
Anything to add to that, Dr. Reines?
I think the only thing that I would add maybe are some numbers to put it into context. So hundreds of millions of doses of COVID vaccine have been given in the United States. Around the world, 1.4 billion doses have been given. This is the most extensively studied vaccine. To date, in the United States, half of all kids 12 to 17 years old have been vaccinated. That's more than 11 million kids who have had 2 doses of COVID. If we were going to see more side effects, we would see them. We have a big enough cohort right now. And there is honestly not much difference about the biology of a 5 to 11-year-old compared to a 12-year-old. We are not expecting to see more severe side effects, especially since it's a smaller dose. We know it's a smaller dose, even though it seems to be as effective a dose when you measure response to the vaccine. So I don't think there's any reason to wait for full authorization. I think that and certainly I can't predict the future, but I suspect we will have another surge in Georgia because of our low vaccination rates. I expect that after the holidays, people getting together, people traveling, Thanksgiving, Christmas, that we will have another surge at some point. And my recommendation to the families that I'm meeting every day is to get the vaccine now. There is really no reason to wait.
Kind of related to the 11-year-old, one question we've received is, should I wait until my kid is 12 so that he or she can get a stronger dose? Do you have any response to that?
I got that question today, and it was a question from a very small 11-year-old. And my recommendation was to just go ahead and get the dose now. It depends. Actually, no, I don't think I would wait. I'd like to hear what Dr. Johnson said. I don't think that we've been given tremendous guidance. I have not read anything about this, Veda, but I think if a child is eligible now for the vaccine, they should go ahead and get the vaccine that is recommended for their age group. A booster dose at some point may be indicated, but that lower dose seems to be the word we use is immunogenic. It seems to be very good at eliciting an immune response. So no need to wait, especially around the holidays when we're going to be getting together, when we're likely going to see more COVID. Hopefully we won't, but I expect we'll see some more.
I had the same question posed to me on Tuesday in clinic. I had an 11-year-old, and the birthday, he was going to have a birthday like next month, right? And so she says, I think I'm just going to wait till he's 12. I said, go get it now. Get it while you're here, because in a month or so you may be distracted. You may have heard some misinformation. If you're willing to get it now, go ahead and get it. I guess the question I'd like to ask is, if they turn 12 before they get the second one, should we give them a higher dose, right? I don't know the answer to that. I mean, I probably would feel inclined to do so. I don't think it would hurt anything, but we hadn't really answered that particular question.
Right.
But yeah, like Dr. Reines said, I would not wait. I would go ahead and get it, because the data has proven that up to 11.1, 10 micrograms is effective. Like 30 micrograms is effective at 12. So I would not hesitate to get it at 11.
And Dr. Reines, what are you hearing? And then Dr. Johnson, please jump in about the little ones. So, maybe this is a selfishly motivated question because I have a 3, almost 4-year-old. What are you hearing about when the kind of youngest group will become eligible for a vaccine?
Yeah. I don't know when that's going to happen. I know that there are studies that are ongoing. Everything that I've read and I've heard suggests that either the beginning or middle of 2022 is when we will have a vaccine for the 2 and older group. I'm not sure about the infants yet, but I suspect the 2 to 4 is going to be next.
I think I was listening to another podcast that said probably about the spring, because of the studies that are ongoing right now, and that they should be finished by then. I think they're aiming down to 6 months. I think they are, if I can recall. So I think they're going to be, available to children before, and that's really going to be a challenge too, I think, with some of the parents trying to convince them that it's important for those little ones to get it as well. I actually had a really, really dear friend to pass away this past year when her 3-year-old granddaughter came back from daycare and gave her COVID, and gave her COVID and gave her mother COVID as well. So it was a mother, and it was a grandmother and the great grandmother, and the grandmother, who was a dear friend of mine, passed away as a result of it. So we know that it's, just as transmissible, not as much, but little ones can transmit it as well. And that we really need to aim to immunize all of our children down to 6 months of age as soon as we can.
Yeah.
So I want to just turn now to, I want to spend maybe about 5 to 6 more minutes, and just wanted to turn to the 2 of you, and Dr. Johnson, why don't you start, and just ask you kind of what other questions you're hearing from parents and caregivers about the vaccine that you'd like to respond to on this webinar? Anything?
Well, there's so much misinformation out there. I find I spend most of my time trying to debunk all of the myths and the misinformation. I strongly recommend to my families that they not, listen to hearsay, that they not look at things on YouTube or some of the things on the internet. I give them things to read. I tell them to go to the CDC website and look at the data and look at facts regarding the vaccine, and to not, be hampered or derailed by, the fears of others. Now, some of the fears are valid. I have to give you that, but they really need to make their decisions based on real data. And so, some people say that we're having compassion fatigue, right? Because we're constantly trying to reassure our families. They come in, we try to them, and then they will say something that seems to be a bit, lack of a better word, absurd, regarding myths about the vaccine and myths about the disease itself, right? And so I just strongly encourage everyone to go to the CDC website and go to other websites, go to the American Academy of Pediatrics website, go to some of these, valid websites that have the data and the facts behind it, as opposed to listening to things that they see on the internet and on YouTube.
Dr. Reines, anything to add in terms of kind of things that you've been hearing, questions from families that you've been hearing about the vaccine?
No, I totally agree with Dr. Johnson. I think there is just so much fear out there. I think that parents really want to do the right thing, but I think there's tremendous confusion. People are relying, as Dr. Johnson said, on social media sites for their news, for their medical information, and the information on those sites is so polarized. Either there's the camp that is 100% in, and there's the camp that's 100% out. And if you're a parent and you're not very medically sophisticated, how do you decide you want to do what's right for your children? And I think that we're confusing people. And I think keeping as she said, keeping parents off of the social media sites, directing them to good sites, I think is the most important thing.
And I've just put links in the chat for everyone. A link to the CDC's page specifically on kind of key things to know about the COVID vaccine, and then also frequently asked questions about the vaccine from the American Academy of Pediatrics, so specific to children and the vaccine. So that's in the chat for those interested. Okay, so any last questions from our attendees, specifically around the vaccine with respect to children, before we move on to talking about mental health and other issues?
Ashli, do you also want to put links up about resources in other languages? I know that the CDC has
Yes.
Information about vaccine. Is there anything that our panelists can recommend for parents with limited English or information that is written in various languages, particularly with regard to children and vaccine? I know this is all brand new and we're just beginning to talk about it, but what is out there and what is the best way to reach parents who may not speak English or who may not be readers?
Yeah.
So, go ahead.
I was going to turn it over to you. This CDC has some very basic information. They have a lot of pictorial information as well that could be helpful. I know sometimes they have information in Spanish. I haven't seen a lot of information in other languages, so I'm not sure what else is out there.
I hadn't either. So one of the things, I actually chair the school health committee for the Georgia chapter of the American Academy of Pediatrics, and we put out 2 toolkits to help physicians as well as school systems as well as community members in understanding COVID and learning how to navigate and how to assist one another in combating the spread of it. And those websites have one resource, the second website, which really talks about the social determinants of health and its relationship to COVID, has one resource that is in a couple of languages. And so you can go on the Georgia AAP's website and look for the COVID toolkits it's actually for pediatricians, but it actually has resources for schools and the community at large. And that's at the georgiaap.org.
Okay, so I'll link to that in just a moment. And also just wanted to alert everyone to the National Resource Center for Refugee and Immigrant and Migrant Individuals, NRC RIM. They have vaccine fact sheets in like 40 different languages. And I just put the links to those in the chat. And they are great. They're like one pager, really kind of distill just the key things you need to know. And so I put that, and I will also link to is it the Georgia Academy of Pediatrics, Dr. Johnson?
The Georgia chapter of the American Academy.
The Georgia chapter. Okay, so I'll link to that in just a moment.
Okay.
Jeannie, it looks like you, yeah, go ahead.
I was going to say healthychildren.org is parent information from the AAP. And that's very well done. And there's a lot of COVID information there too.
Great.
And
Okay, I will.
Our partners, Refugee Women's Network, has developed quite a lot of information that's very easy to read in various languages. So if somebody wants to put the Refugee Women's Network contact, I don't see anybody here tonight from that group. Oh, I know why. They have a hiking party tonight for the women that have been involved in their hiking club. And they weren't able to join us, but they have quite a bit of information that's very simple to read in a variety of different languages. And I believe IRC does as well. So I just want to make sure that people are aware that there's not a lot out there, particularly around children and the new vaccine that's now available to children. There's not a whole lot out there yet in multiple languages, but hopefully it's coming.
Yeah, the NRC RIM links do have a couple of fact sheets related to children and the vaccine in, I think, 40 different languages. So that's the best resource I've seen. It looks like, is it Jeannie Rodriguez? You turned your camera on and just wanted to see if that signaled that you had a question. And if so, please go ahead.
I just had a comment that on the CDC site, and including the one that you had the link to, the first one that gave basic information, a lot of people miss it, but under the title of the web page, there's a little button that says languages. And if you click the down arrow on that, there oftentimes the information there is available in multiple different languages. So that's another language resource as well.
Great. Thanks so much, Jeannie.
And I see Dr. Harji on the participant list. I've wondered if, put her on the spot, if she has any resources that haven't been suggested yet. Thank you, Jeannie. It's great to see you. Or if anybody else on the call has a resource that they particularly like.
Well, I think you've mentioned everything there is to. At our clinic at Clarkston Community Health Center, we obviously do have, brochures in different languages, but I think there is just so much information even on all these websites that anybody with any language can get all the information they need for safety and otherwise. But thank you all to all the speakers, and a shout out to Veda, my alum.
I also see that Dr. Malone is on and just wanted to give him an opportunity to comment on what FNA is offering if he is able to unmute. And if not, we can always circle back to him later.
Yeah, I'd be happy to share. As far as like resources, yeah, we use all of these that you've mentioned, and they're really excellent. And there are, as far as like the actual EUA fact sheets, those have even been translated to a number of languages. And I'll go ahead and see if I can find the link to that and post that in the chat also, or I can send it to you.
Yeah, that'd be great, Dr. Malone. Thanks.
And then as far as just things that we offer, we are a site in Clarkston that has the Pfizer vaccine for 5 to 11-year-olds and also then 12 and above. So, but I know that you'll talk about that later. So, yeah.
Great, thank you.
Mm-hmm.
Okay, so at this point, Roberta, I will turn it over to you and we'll transition to talking about mental health and the other things that we have seen crop up in children as a result of COVID.
When we were first talking about having this webinar, the first issue that we for children, we thought about really the mental health issues and that we're seeing, and also the impact of COVID on families with young children in general. And of course, then the new vaccine came out for children. So we're really excited about that. So we really brought the two issues together in one webinar or one session. And we hope this is the beginning of lots of discussions about the vaccine for children and also its impact on children and really their families. And when we're talking about children at this particular topic, we're really talking about babies up to about age 8. And what kind of impact we're really seeing on some of the younger children, which might not be as evident in some of the school age and some of the other children. And so I'll give you, an example. About a month ago, I was with a mom, some mom, and at one of our outdoor events, and she said, "I'm so glad to be here because I have been literally cooped up in the house." She was from Somalia, and her English was perfect, so we really had a good conversation. And she said, "My 3-year-old and I have been in the house together forever." And I'm afraid to go out with her. I'm not sure where we can go. I'm afraid to go to the playground because it's not very safe. We've read every book that we have in the house. I'm teaching her the ABCs, but I'm not sure I'm not doing it the right way. I'm reading to her, I'm talking to her, but we're really sick of each other. But we were so glad to be able to get outside. And I'm thinking about this little toddler in the house with this really lovely mom trying to do the best she can and thinking about all the stresses that are on this family. So I just wanted to ask you both, what are some of the emotional and psychological challenges that you've been seeing in some of the families that you're serving?
Well, so I guess I can go. You're seeing a lot, sort of an understatement. I guess the thing that is striking to me, my 30 some odd years of practicing medicine has really been targeted to the underserved. And so a lot of the social, emotional, behavioral, mental health disorders that we're seeing now, I've been tracking that all of my life, right? And so it's nothing new. None of this is new.
And that's what
It's
we've
just
been
been, it's just been exacerbated. It's just been exacerbated by the COVID, mainly because of what you just described, children who've been, sort of cooped up in the house with parents. Now, you describe a really sort of optimal environment. You know, unfortunately, there are a large number of children who are cooped up with families who are really struggling to survive. So there's a lot of stress. There's a lot of domestic violence. There was like a 30% increase in domestic violence last June worldwide before we got into the heart of COVID, right? We know that children have been traumatized on so many levels. And we know that, you know, directly traumatized, but we didn't see an increase in child abuse because schools were closed. And the number one reporting site for child abuse are the schools. But we do know that children witnessed a lot of violence and probably were the victims of a lot of violence. We're seeing a lot of depression, a lot of anxiety in children who are in a fairly stable environment as well, because, you know, they're social animals, especially the teenagers and the middle school children and school-age children. And so they've really been stressed out because they can't, you know, be with their peers. And I guess they get sick of texting and talking to each other and watching YouTube and all those other things as well. And they just need to get out. So we've seen a lot of stress, you know, related to that. I think probably the most profound indicator of the stress that children are dealing with is the fact that over 175,000 children have lost a parent or grandparent to COVID. So think about the grief and the loss, the anxiety, the loss of stability that these children are experiencing.
She just froze for a minute.
Yeah.
Hopefully she'll come back. She warned us that she might have some trouble.
Yeah.
There.
Yeah, so that was an MMWR report that came out recently, that 1 out of 500 children in the United States has experienced COVID-19 associated orphanhood or death of a grandparent caregiver. That's just, you know, this has just had a tremendous effect. The only other thing that I would add to what Dr. Johnson was saying, I'll emphasize the challenges in learning. We have kids who, you know, were supposed to start kindergarten or first grade and never got to go to school. They were home in families with older children. There weren't enough computers. Maybe there wasn't good internet access. Parents were struggling to keep up with work. We have children that missed 1 year of learning, 2 years of learning at a time when, you know, at a time when when kids should be learning to read. It's critical that they learn during those early years. I see a lot of children with autism. I see a lot of children with learning challenges, and those children were not able to get the special education services. Their families really had difficulty working with them. Children who were supposed to be getting speech therapy and occupational therapy and did it online. And, you know, it's fairly impossible, I would have to say, even with the very best therapists, to have productive therapy sessions with a 4-year-old or a 5-year-old. So just tremendous difficulties with learning. And these kids, you know, hopefully they're going to catch up, but it's going to take years until they catch up. Absolutely years. There was a lot of demand in my practice for ADHD medications from parents who decided, because it was so difficult to work and teach their children, that kids probably had ADHD, and I had to talk a lot of parents out of putting their kids on medication. But that was a frequent ask. Did she make it back? Not yet.
I'm not sure.
Yeah.
I've heard something similar. Dr. Reines, you were talking about ADHD and ASD, and I have a friend whose child has ASD and was getting most of his ASD related assistance in the school or through an outpatient facility in town. And then of course, when COVID hit, that all went away and he wasn't getting any and has really regressed, I think. So it seems like particularly with kids with special needs has been very profound impact.
But we're still seeing families who are afraid to send their kids back to school. So while most families, I think, have, returned to school, there are a lot of kids that are still at home, and parents are still struggling, and they're afraid of they're afraid of COVID. They're not COVID deniers, but they're afraid of COVID, and they're afraid of the vaccine, and they're paralyzed. They don't know what to do next.
And we've talked some about strategies, and I think we really see the problem. And I think if Dr. Johnson were back on, she would be eloquent about that these are problems that didn't just start with COVID, that the stresses that a lot of families feel, the impact of not being able to access good housing or the early learning that they need predates COVID. And what we've seen with COVID is just as exacerbated some of the problems that were out there anyway. And so probably in the next 20 minutes or so that we have left, we really want to talk about, so what are some ways that we can begin to mitigate some of these impacts? So we leave on a little higher note, that we begin to impact and make a difference and mitigate some of the impact of COVID-19 on children and their families. One of the things that we'll look up that I think Clarkston has done particularly well is the use of trusted messengers. We know that works. We know we probably need more of it. We need more folks, and there's some folks on this call that I think are trusted messengers, to learn from the experts and be able to talk about the science, talk about the importance of the vaccine, talk about masks to families in their language, using their culture in appropriate ways. What has been the experience so far of the panelists and people on the call with the use of trusted messengers? How is that working? How can we make that even more effective in Clarkston and the surrounding communities? And so I'll turn that over to the panelists, but also to people on the call.
Yeah, so I am not working right now in the refugee pediatric clinic, and haven't really been working in the Clarkston community. So I'm not sure what is going on, within that community. So I don't know if some of the physicians who are working in that community want to talk about that. I think we generally have to promote vaccines. We have to make sure that we're not dismissing families that are vaccine hesitant. That's something that I see in a lot of pediatric practices, that they want to dismiss patients who are not going to get vaccines. And we've not taken that approach at Kaiser. We invite those patients to come in and tell the parents, you're here, you're going to have to listen to me talk about vaccines. It's your child, you make the choice. But we think of every encounter as an opportunity to convince people to get vaccines. And we're not successful every day, but I would say we have successes every week. And I'm not just talking about COVID vaccine, I'm talking about all vaccines, because we have rising rates of vaccine hesitancy. I think we have to really listen to people and listen to what their concerns are, and address their concerns. And I think that we can't tell people what to do. We have to work with families, and we have to gain their trust. I don't know if you want me to keep talking about things that I think we can do, or you want to speak more about the vaccinations. Roberta, do you want to talk more about vaccines? I think there's more we can do in terms of behavioral health care.
Right.
I think that we have to, I think we have to integrate more behavioral health specialists into primary care, into schools, into community centers. I think that that is critical. I think that kids have been cooped up in their house. We have to have better access to parks and playgrounds, outdoor activities. I think nutrition has been a big factor. We haven't even touched on the weight gain and rising rates of obesity that we saw over the past couple of years. And this is not just teenagers, this is young children as well. And so we really have to, I think, address nutrition as a community. This is not something that can be done alone in the doctor's offices. It has to be done in schools. It has to be done in community centers. Yeah.
I think Dr. Johnson she's, it looks like she's back on. And I know that like nutrition is something that she has some expertise and interest in. I don't know, Dr. Johnson, if you're able to hear us and talk, but just wanted to piggyback on that point that Dr. Reines was mentioning, because I know that's an area of yours.
Yeah, it is. And I apologize. I just knew my computer would go out, and on time it went out, right? But let me just add, so before I talk about obesity, let me just add just one other thing to what Dr. Reines has said about how do we mitigate all of the issues, the trauma, and the social emotional impact that COVID has had on children. I don't think we can do anything effectively without addressing the needs of their parents. We can't care for children in a vacuum, right? And, and even though we've tried, for many years, we realize that, whatever we do with them in our office or in the schools or whatever, they go right back into that environment that causes all of that stress and all of those social emotional upheaval. And so we really need to extend our arms out to our families as a whole. I know we're pediatricians, we aren't supposed to be as involved with that, so I was told. But I guess I've spent the past 35 years working in the context of the whole child, which means the families as well as the community as a whole. So we need to create systems of support for not only the children, but also the families, because these are the parents who are stressed out, who've lost their jobs, who are losing their homes, who have been subjected to violence, all of those things that still impact children. So I just want to throw that out. I'm just going to make one comment about childhood obesity, and Dr. Reines and I know we've seen 40, 50-pound weight gain in children over the past 18 months. It has just been unbelievable. Wow. Now, I felt like I was a complete failure prior to COVID when it comes to addressing childhood obesity. I really feel like I'm a complete failure now because of the challenges that we're dealing with. But, we basically institute the same, recommendations and the same approach to children, the fact that they've been cooped up, they've been eating everything, they're on their tablets and their computers, and they never go outside. And for some children, even, if they weren't cooped up, they weren't able to go outside anyway because it may not be safe. But we still, promote, good eating habits. It is probably the most complicated thing that I've ever done as a pediatrician. I don't know about Dr. Reines. I don't know if you've had if you've been as much of a failure as I have. But I've worked very hard.
I think I've been worse.
I think my greatest success has been when I was in the community, when I had my school-based health center, and I was able to work with children in the context of the community. I was really successful in many ways in reducing the risk factors associated with childhood obesity. But whatever the solution is, it has to be entrenched in the community. It has to be, as you said, having safe places for children to go after school, encouraging families to do this work together. I found that my greatest success comes when an entire family is working together to lose weight. That means that they're eating differently. I think COVID not only has, it created this sort of environment where children just sit around and eat all the time, but families are eating out all the time now. We found more families going to fast food restaurants, eating those, 2,000 calorie meals, on a regular basis. And, for many reasons, sometimes eating out is cheaper than cooking in because of the cost of food these days. But it really takes a really comprehensive approach to dealing with childhood obesity. And it really does involve having the family participate as a unit in order for children to actually, for us to put a dent in childhood obesity. But I think, I was talking to a mother this past week, and her child had type 2 diabetes, and she actually was diagnosed during COVID, and she has actually lost a little weight, but she had gained 60 pounds since the beginning of COVID. And we found out she was in a car accident and found out she was a diabetic when she went to the emergency room and ended up, having been hospitalized for a long time. It is such an epidemic right now. It's just overwhelming for us. But I continue to use the same strategy because I have had some success when I involve the entire family. When I find resources for families such as WISE and parks and any other opportunity for them to get outside, and also to minimize the number of times that they eat out, and to eat more healthy, and to drink more water, right? So that has been my approach. I'll see where it takes me from here, but we really have a challenge in front of us when it comes to that now.
I think that one of the things that I know the PRC is doing is really looking at the impact of COVID on whole families with some surveys, and we've also done some parent voices and talking with families and finding out pretty much a lot of what you talked about, and getting their ideas about what they think they can do to make changes. And I think we won't address it all in this webinar, but that is the next step for many of us to really begin to look at some planning about how to change that trajectory, how to really think about using the outdoors and getting opportunities for families to use parks and more activities outdoors where they feel safe. And I can't help but sit here thinking about Friendship Forest, if the mayor is here, and the fact that that has been recently renovated in Clarkston, and nobody knows about it. It is gorgeous and it's safe, and they've got lights up, and it seems like one community strategy is to make known the opportunities and actually have events that are outside so that families, even in the winter, can get out and be together and have activities. There are two programs that I do want to mention real quick, and that is Kindergarten, which is a program for parents and children that it's held outside for children and their parents to experience nature together. And we're beginning to move that in Clarkston out and find some money and opportunities for that. It's been really well received by parents who, for some reason didn't mind watching their kids make mud pies and getting dirty. I was really, really excited about that, that parents didn't seem to mind their kids rolling down the hill or playing with the leaves. They were glad to be there with their kids and actually help make the mud pies and bake them in the sun. So I think more opportunities for parents to experience outdoors and activities is some community strategies that I know we're going to be looking at. So we really would welcome, the panelists' ideas of things that communities can begin to do to begin to mitigate some of the impacts you're talking about. Are there any other things that you've seen that communities have done around Georgia, around the country, to begin to address some of these issues? Dr. Reines talked about having more mental health staff. What are some of the other strategies that you think would be useful for communities and cities and counties to pursue?
Well, there's so much that's going on as a result of COVID that's really good, that we need to advocate for, that it continues. The child tax credit, the fact that we're increasing the amount dramatically.
You need to call our legislators right now to make sure it sticks.
Yes, because I think it was like $2,000 for every child prior to COVID. Now it's $3,600.
Right.
Above a certain age, I can't remember, up to 6, and then anyway, it's much higher. And so it's projected that if we continue that tax credit, we can reduce childhood poverty by 40% in this country. which is really just, amazing, because we know the impact of poverty on children. Like I said, all the issues that we were talking about right now were present prior to COVID. It's just gotten, 10 times worse because of COVID, and the fact that people have lost their jobs and are losing their homes. It's just really, going to contribute tremendously to it going forward. I don't know what we're going to do about families being evicted, but we really need to advocate, for some sort of stay or some sort of support for our families who are going to be on the streets in a minute, many of them, because of the fact that they're lifting that. And the fact that it just didn't work well in some of the states because they chose not to implement it well. And just like I said, having, as Dr. Reines said, having behavioral health services, but for everyone, for not only the children, but for the families, for the grandparents. We have a lot of these wonderful grandparent organizations. I was talking to them not too long ago, talking about, the need to shore up these wonderful caregivers who are also struggling because of COVID, and of who many have died because of COVID, right? So, as beyond just what we can do in our offices, is what can we do as a society to continue to support and build up a lot of these families who will continue to struggle as a result of this, right? So, we're being called upon to be mental health providers more every day as pediatricians than we have in the past, and we can prescribe medications. I don't know about Dr. Reines, but I feel fairly comfortable in prescribing, medication for depression and maybe oppositional defiant, and for some anxiety, and of course for ADHD. But I'm not a counselor. Well, maybe I am, but professionally, I'm not a counselor. Plus, I don't have that amount of time when I go into exam rooms, even though I probably spend most of my time counseling. But the reality is that we need to think outside the box when it comes to identifying people who can serve in that capacity. It may not be just a psychologist or an LCSW or MSW. It could be peer supports, which we have a lot of that in this state. And we need to train people to be more effective in providing those services, because we're going to need more of that. So I think it's, there are a lot of things that we could be doing, could be advocating for, but I think one of the priorities has to do with the basic needs of our families and writing our congressmen and everyone else so they can continue the work that they've started. Childcare was improved, during COVID. They had an increase in the CAP applications. Food insecurity, we're not going to get into that, how everybody stepped up and started extending themselves so that families would not go hungry. We've got to continue all of that work in order to combat this and continue it going forward, because it's not going away. It's not going away.
Let me make a plug for some federal advocacy. We really are, I should have gotten the links tonight, but we will be getting more information out, and we have gotten information out about the need to write our Congress people about the child care tax credit. The deadline for getting that tax credit without filing a tax return has passed, but there is still an opportunity to get quite a bit of money if you pay for child care and you fill out a tax return. And a lot of our families don't do that, don't think they need to, but if they do, they'll be eligible for some of this money that Dr. Johnson was just talking about. So getting our health promoters and our health advocates knowledgeable about some of these federal resources that are available now, including the child care tax credit, the income earned tax credit, the child care subsidies have been raised by the state, so that people that were not available, that were not eligible in the past because supposedly they made too much money, which was also a laugh. Now that income limit has been raised so that more people are eligible for the child care subsidy, which means that a lot more people can go back to work. So we need to be getting that word out, so that will also help, I think, with a lot of the issues we've talked about, getting more money into families so that they can spend it on housing and food and not eating out, I think is one of the goals, in addition to making sure that people are not evicted. We've done a fair job of getting rent and mortgage crisis money out again in the central DeKalb area. We probably could do a better job, but we need to keep that money flowing to make sure that people are not evicted because they can't pay and they lost their job. Well, I think now we probably want to turn it over to see if our participants have any questions, or if our panelists have anything else that they'd like to add, and maybe Ashli to say a little bit about some of the activities of the PRC that are forthcoming that people might be of interest.
Well, and just to follow up on your comment, Roberta, about the child tax credit, the Children's Defense Fund has an advocacy page where they have instructions and templates for how to contact your congressmen and women. And that's all like laid out really clearly on their page. So I put a link to it in the chat.
Okay. And if you would like to email me, put my information. We have some information also, and also on the child care subsidy increases and how to access that.
Great. Yeah, I mean, I think certainly if there are any questions from the audience, now's a good time. I'll just pause in case you're still thinking about it or want to put anything in the chat.
I would like to share something that you're doing. We've talked a lot about, or some about, trusted messengers, and if there are any examples or any ways that we think we can even expand that program or how it's working.
Yeah, Jenny.
I have a quick question. So I work with children in preschool programs, mostly Head Start, early Head Start programs. And one of the things that I hear a lot from people there is that families are having a really hard time getting in to do primary care visits. There just aren't enough visits available. Some providers aren't seeing patients, they're seeing them online only. And if you have limited resources, it's difficult to really do that. So I just wanted some thoughts about that. Just, it's so important that especially young children continue to get primary care. And it just seems like access is a bit of an issue right now. And I wonder about your thoughts from the panelists about that.
So I can tell you that at Kaiser, we have many offices around town, and we have been up and running throughout the pandemic. We had some offices initially that were doing only well child checkups because we wanted to maintain immunization rates, and some offices that were doing sick visits. At this point, all offices are doing everything very safely. We have a full complement of doctors and nurses appointments. I think one of the changes for us is that we are doing video visits if families want video visits, but they always have an option to come in to the office. My pediatrician friends are also working. They're seeing patients in their offices. I think we've all figured out how to do this pretty safely now. The physicians, nurses are all vaccinated. So I'm sort of surprised to hear that comment, I have to say, right now. I think I would have believed it maybe 12 months ago, even 6 months ago, but right now I thought people were up and running.
We are. I think we are up and running. I think the problem, I believe you when you say that, because it's 3 months out to get an appointment with me. We're really catching up. And for some, Kaiser is a much bigger, mammoth institution where they have multiple sites and multiple physicians, but for some of the other doctors who have been up and running for a long time, it's really about catch up right now. And so I do believe you. I had a parent who came in on Tuesday who's been trying to get in to see me for 6 months.
Yeah.
And even though we changed the our practice during COVID, where we were actually seeing just children under 5, to tell you the truth, so that we could keep up with the little ones, we still fell behind. And so I think we're in a much better place right now, as Dr. Reines has said, because almost everyone's up and running, but it really is a catch up right now. So tell them not to, be discouraged. Just
Yeah.
And if it's really an emergency, I always tell my schedulers, double book me, right? Because I know that people are trying to get in.
Yeah, and I think that's consistent with what you just said with what I'm hearing people say, and two, it's difficult with some of the Head Start centers. They have to get those checkups done within 90 days of school entry. And so when you're booking 6 months out, it's a bit of a challenge for them, right? So I will certainly relay the message that we are playing catch up, and it should get better hopefully soon.
So I just put the link to the local resources for vaccines for children in the chat. Roberta, would you like me to go ahead and share that slide with everyone at this point? Okay. Let's see. All right. Hopefully you guys can see that. So this was put together by one of our fantastic Prevention Research Center students. Actually, I don't know, Suad, you might be on. And so I will also, I think there's a link here at the bottom. This is the link I put in the Zoom chat. And then a version of this is available, like I said, on this website here. But this is just Suad put together this list of who's offering COVID vaccinations in our immediate area. For those of you on the webinar who are in Atlanta, there may be those of you, maybe this advertisement for this webinar went beyond the Atlanta metro area. So, but this is just our kind of local resources. And again, the link to all of this is in the chat. So please do use this, and we'll be updating it.
I was on a meeting today with the area vaccine coalition that Gina and Temple coordinate, and IRC reported and CORE that they will be offering vaccine in about 2 weeks. So we know that we'll have other updates to this.
Great. That's great. Okay. Any other final comments, Roberta?
No, I don't think so. I think we want to thank our panelists. I've learned a lot, and as always, and thank you for being with us, and thanks to the participants for sharing their insights and their information as well.
Yeah, thank you all for joining, and Dr. Reines and Dr. Johnson, thank you so much.
Thanks for having us. And I again from my computer, but I knew it was going to happen. But it's been great having this conversation and sharing the stage with Dr. Reines.
Yes, thank you all very much.
Have a good weekend.
Thank you all.